Teresa Nagoya. Hello, we're back again. We're on the live series. We go live. So, if you're just coming across this channel, all you have to do is to drop a comment on the comment section and let us know where you are watching us from. My name is Mercy Mary, and today's live, I'm going to be talking about what's your take on abortion. What is your take on abortion? What is your take on abortion? Because I want to do a series on abortion. Yeah, I've started doing a series on abortion where I'm going to be talking about abortion in details, the different types of abortion, the medical types of abortion, the surgical types of abortion, what it entails. While abortion is recommended, like abortion is recommended for some medical reasons and also for some personal reasons, people decide to do some abortion. So I'm going to be working on that series of abortion. But before that video starts dropping, I would like to know, what do you think abortion entails? Is abortion advisable? Is it something you like you want to get yourself involved in? My personal belief is different from everybody's personal belief about abortion, but I would like to know your take of what abortion entails. So we have Junior. Junior, how are you doing? Can you let us know what is your take on abortion? Is it a yes or a no? Kelechi Samuel, can you let us know what's your take on abortion? Is it a yes or a no? Then we have Ephraim. Ephraim, how are you doing? Can you let us know your take on abortion? Is it a yes or a no? And if possible, I will appreciate if you give us the reason for your answer. Is abortion a yes for you or a no for you? All right. So we have Mr. Dogs. Mr. Dogs said, "Hi from the UK. Abortion is needed, but only for emergency reasons. Here in the UK, they passed a bill that abortion can be done at any stage, even up to 9 months and just before birth." Wow, this is the first time I'm hearing that, Mr. Dogs. I was thinking abortion is usually between a period of when it's above 24 weeks, you can no longer abort the baby. So that's what I am aware of. Maybe I've not really know the recent updates in the UK about abortion. I was thinking once it's 24 weeks, abortion is no longer advisable, but I'm going to research more and check. Okay, you said it's a bill, so they've not finalized it yet. All right. So Mr. Docs, what is your take? Do you feel that we should encourage more abortion, or do you think that, oh, you're saying no to abortion? Because there's this um everybody's opinion on abortion. Yes, we should encourage abortion. No, we should not encourage abortion. So I'm doing a series now. I'm going to be talking about abortion, the different types of abortion, a lot of myths associated with abortion. So I'm going to be doing a series on that. So I would like your intake to find out what your personal intake about abortion is before I go into details of what I have to share today. So Sammy Love Chigozie said, "Hi, hello Sammy Love, how are you doing? Trust you're doing great. It's nice having you on the channel. And if you are just coming across, kindly let us know where you are watching us from and tell us your name on the comment section. Let us know what's your take on abortion." So Mr. Doug said, yes, it's 24 weeks. Yes, that's what I know. So I don't know about the bill that has been passed about 9 months abortion. All right. Okay, you can keep it there and go upstairs. Okay, well done. So that's my daughter. She just finished her lunch, so grandma is upstairs. So, Mr. Dorwicks, yes, 24 weeks. Thank you very much. Just let us know your take on abortion. Personally, my personal belief, I'm not going to share it about abortion because I'm a medical practitioner. So my personal belief doesn't count in this situation. So I would like to know what your take is. But from what Mr. Doc said, he said they are passing a bill in such a way that abortion can be done from 9 months. That's like a full-term baby. Like, for me, what would be the essence of terminating a full-term baby? Like, to me, it doesn't make sense. If you can carry the baby to full term, which is 9 months, the best thing is just to give birth to the baby and either put the baby for adoption. All right. So if that bill is passed, I don't know how many people are going to approve that bill, how many people are going to utilize that bill. Because for me, if a woman is able to carry a child to 7, 8, 9 months, so what is the need of terminating the baby? So that bill is looking strange to me, but I will find out more about the bill that was passed about abortion. I really want to read it and know more, because if I'm able to carry a child to term, I don't see any need for me to take or terminate the baby, rather I'm going to push the baby out and highest give it out for adoption, because it's a long journey. Even 7 months, 5 months, it's a long journey. All right. So, Mr. Docs, is nice having you. Sammy, let us know your take. Let us know where you're watching us from. Let's keep the takes coming. And if you are just joining us, just double tap on the screen and it automatically likes the video. Double tap on the screen and it automatically likes the video. Sammy said he's watching from... Sammy's watching from Owerri, Imo State, Nigeria. Thank you for joining us, Sammy. Molumage, can you let us know where you are watching from and how are you doing, Molumage? You're always on our live sessions. Thank you very much for always joining us. Maduka, Candy, let us know where you're watching from. Is watching from Nigeria, Owerri State. It's nice having you. Do you have any question for us? And also, what is your take on abortion? Do you have any question for us? Thank you for all the love emoji. I really appreciate the love emoji. Who is dropping this lots of love emoji? I really need to know you. If you know you're the one dropping all the love emoji on the YouTube channel, can you let me know in the comment section? Thank you very much for the love emoji. Don't forget to double tap the screen to like the video. And also, don't forget to subscribe if this is the first time of coming across this channel. We've been away for a long period of time and we are trying to come back. So we have Gift. Gift, David, how are you doing? Longest time. It's the longest, I think. Yeah, Gift David, you've always been following us on our live. If I'm not mistaken, can you let me know if it's another Gift David? But I know there's a particular Gift David that usually show up on our lives and drop a lot of comments on our videos and also watch our videos. So if you know you're that Gift David, can you let me know on the comment section? Gift, is nice having you on our live section. If you have any question, kindly let us know. Definitely, I'll be able to take and answer your question, Gift David. Oh, Gift David, I thought as much. How are you doing? Longest time. Trust you're doing great. Do you have any question for us on today's live, Gift? Do you have any question for us, Gift? Long time no see. Yeah, we've been away for some time. We're trying to come back. We're trying to come back. We've lost a lot of activity on our YouTube channel. So we have Super Toyota said, this is a good topic. Serious on abortion is needed, but for emergency, not just because women want to get rid of the pregnancy. Okay. That is good. There are serious reasons why abortion is needed. Okay, let me share some takes, some medical reasons why abortion is needed. Am I expecting someone? Okay, I'm expecting a delivery. So to make a video, somebody asked a question on the use of female condoms. So I ordered female condoms from Amazon. So I believe that's what just delivered. Just give me some few seconds. I'm just going to get the delivery. I believe it's the female condoms that I ordered from Amazon. Let me just quickly get the delivery. All right. I think okay, I'm back. So this is an Amazon delivery. Like I saw on my comment section, I have always thought about how to use the male condom. I've opened the male condom, but I've not really talked about how, I think this is for me. Yeah. I've not really talked about how to use the female condom. So I had to when I saw the question, somebody asked me about the female condom. I have to quickly order from Amazon because I can't really go out to the pharmacy. because that's a lot of work. So I had to order from Amazon yesterday, and luckily they delivered it today. So hopefully, hope it's not something else though. So this is a female condom I ordered from Amazon. So I'm going to be making a video talking about how to use the female condom soon. So for those that don't know how to use the female condom, so the video is going to be popping up soon. You can see I spent a lot getting this condom. I spent a lot getting this just to make videos for you people. I had to spend my money to get this. So it's the one. So this is the Pansante. I'm not doing any brand advert. So I'm just trying to get any female condom to actually explain. So I'm going to see how I can make the video, maybe today or tomorrow, but I don't know when I'm going to upload it. I'm going to make a video explaining how to actually use a female condom so that people tend to understand, because people keep asking me this question, oh, how do I use a female condom? I've not heard about female condom. I only know about male condoms. And so that's why okay, this is 3. I think we have 3 female condoms here. So we have 3 female condoms in the pack. I'm not patient enough. So who's going to pay for our condoms? So this is female condoms. Yeah. So this is female condoms. Same way you have the male condoms, we also have the female condoms. So I'm going to make a video on it and let you know. I had to buy this because I have to create content. And luckily, the condoms were delivered when I'm on live sections. So Sammy said, for me, abortion is a personal something. For someone, personal reasons, but at times, emotions, conscience, religious belief make it look like an evil act. But instead, a pregnancy will take one's life. It is better to be aborted. Yeah, there are a lot of medical reasons why abortion is needed. So, okay, let me just check. So I want to know your take on abortion. I really need to know everybody's take on abortion. Okay, this is a female condom. It's 3. I don't have any use for it. I don't have any personal use for it though. So if you want me to open one of this condom on the live section, let me know so that you have a view of how it looks like before I make the video proper. Personally, I don't really know how to use it. I'm going to be reading the instructions and I'm going to follow suit to make the video. So if you like me to open one of these female condoms on the live section, just let me know and I will open it so that you have a view. For those that have not seen it before, I'm going to open it so that you have it. If you want it, just let me know in the comment section. So in terms of abortion is like a very, very controversial topic. It is legalized in most countries. If you check, abortion is legalized in most countries. And you can decide to use the medical aspect of abortion or the surgical aspect. I'm going to be making a video, so it's going to be a series. So if you want me to open this female condom, let me know in the comment section. For those that have not seen it, this is a brand. I'm not advertising for the brand though, so I can't say how effective this one is. So if you want me to open it on this live section, let me know in the comment section. The delivery just came. You can see the pack. So Toyota said, my ex and I tried using those few years ago. They were fun. That's nice. It's good. Okay, Friday said I should open it. I don't really know how big. Okay, I need like 5 people to say open it, and I'll open it. 5 people tell me to open this female condoms, and I will open it. I need like 5 people to tell me. I'm going to open it though. So please, if you are watching, just let us know where you are watching us from. My name is Mercy Mary, and on this channel, I talk about reproductive health. I talk about sexual health. I am not a sex therapist. I am not a sex expert. So what I do is to give you the little knowledge I know from midwifery about health so that people stay informed. All right. So I've been doing this 12 days of safe sex series. And one of these 12 days of safe sex series was that there are 2 types of condom. We have the male condoms and the female condoms. And when I made that video, people were like, they've not heard about the female condom. They've not seen the female condoms before. So that prompted me to actually order for these female condoms, which I did. So I'm going to open the female condom so you have a view of what it looks like. Okay. There's something about most of these products. Sometimes we always look for where to bust it. Okay, someone said open it. Though I have seen it before, but keep wondering how it could be used. I'm going to make a video for it though. So if you look at it, they have a space where you can just easily tear it. You can see. Why some people are like, oh, where do I tear it? You want to just forcefully use scissors or anything. It's not even advisable for you to use scissors to cut your condoms. It's not in any way advisable for you to use scissors to cut your condoms. So just look at the tip. You see a place where they tear it. I think it's in all of them, all of it. So this is the bit. Who is dropping this love emoji? Thank you very much. But let me know who is dropping it. So you can see it has a space where you can easily pull it, where you can easily tear it. So when you just look at the condom, first of all, before you open any condom, I'm going to make a video like I earlier said. Before you open any condom, check the expiring date. Let's see. Let me find out where the expiring date is. I'm trying to get the expiring date of the condom. I can't find the expiring date. Let me check the carton. You can't find, okay. It's expiring 2028. So they wrote it on the carton. They didn't write it in the individual pack. So this one is expiring 2028, August 2028. So it's still valid. So when you are checking, you have to check if there's any air in it. If there's any air in the condom before you open, you've checked for the expiry date. And remember, don't use scissors or any bits to open. So I'm going to open this one now. So we're going to open from this plate. You can see it's easy. You don't need pressure. So this is it. We're opening the female. So this can prevent abortion. This is a type of family planning. It can actually prevent abortion. So you can see. I'm not going to lie to you. This is the first time I'm holding a female condom. Yeah. So this is how it looks like. So I'm not holding it properly. I'm going to do a video explaining how it works. So this is how it looks like. Let me see. It has 2 rings. Let me see if I can take that ring out. Bless you. I think this ring, see, you can take it out. So this is how, it's kind of big. Did you see it? Then it has this ring inside. I think this ring is to actually hold it down in place. That's it. So for those that are asking what the female condom is, this is how it looks like. So this can actually prevent you from doing abortion. Check it out. All right. So this is what the female condom looks like. And it has the ring in it. So one thing about condoms is that condoms is the only type of family planning method that protects you from STIs. And it also protects you from unwanted pregnancy. So that's why condom is like very good family planning method, because it's the only one that does the 2 job. All of that family planning method just do 1 job, but condom has a lot of jobs to do, like just more than 1 job and all those bits. So I'm going to read about these female condoms. It's been long. Then I'm going to explain how it works. So this is a manual. It has a manual. It has a guide on how to use it. This is like a guide on how to use it in different languages. Okay. All right. I think I have a bit. Okay. So anticipate the video on how to use a female condom. All right. Anticipate the video. The video will be dropping soon. So I just wanted to show you guys how it looks like. So for those that are just joining, this is how the female condom look like. And it's more expensive. It's more expensive than the male condoms. It's more expensive than the male condom. So I think that's that. It has some lubricant. This doesn't have a lot of, for me, it doesn't have a lot of lubricants in it. It doesn't have a lot of lubricants in it. So I think I have a male condom that I used here. And there was one video I shot and I used, sorry, I'm trying to get if I can see. I used to have some, okay, I think so. When I shot a video, I have some Durex here. Hello, Awaniso. This one, I don't want to open it because this is the last pack I have and I want to use it to make another video. So we're going to be talking, when I'm analyzing the two types, I need to make another video. So I can't open this. This one is the male condom. You can see the male is smaller in size compared to the female that comes in this big pack. So the female comes in this big pack and the male comes in a small pack. You can see the difference. So this is the male condom is small and this is the female condom. Do you have any question? Do you have any question? Do you have anything to say in regards to this? So I'm keeping this. I don't want to open it on this live because I want to use it to make another video. This one is expiring 2029 and this one is expiring 2028. Yeah, I'm going to be making a video on how to use it. So I'm going to explain it proper in a full video. This one is just me showing you. So what I advise you to do, if you are just coming across this channel for the first time, what you can do is to actually subscribe, turn on the notification button so that when I upload the video, you are able to get it. All right. So subscribe to the channel, turn on the notification button. When I upload the video, you are able to see the video and get yourself educated. One thing you should take note about using this male and female condom, don't use both together. For people that are trying to say they are trying to play smart, they're like, oh, I just want to protect myself. You as a female, you use the female condom and your male partner use the male condom. It is not advisable. It is not advisable for you to use the male and the female condoms together. That's something you should take note of. If you are using the male condom, use the male condom. If you are using the female condom, use the female condom. Don't use the two together because it's going to create friction. And when there is increase in friction between the male and the female condoms, it can lead to tear. You get the condoms can tear because two things are coming together. There's friction. That's why it is advisable for you to use one. You and your partner should agree. Are we going for the male or the female? Not you trying to play smart all in the name of, oh, you're trying to be safe. Then your partner puts on the male, you put on the female. You think you have double protection, but no. You don't have double protection by using the different one, by using both at the same time. You either stick to one. Is that you both have agreed to use the male or you both have agreed to use the female condoms? So that's what I have to share. In terms of Rawani, like I earlier said, I'm going to be making a detailed video explaining this. I need to study how to use this properly. So then I'll come back and explain how to actually put it so that you have a better understanding of it, okay? So I'll keep this so that I can use it. So that's that. Is that okay? Okay, I think Buy Explore said, respond us. Let me see what you said. Hi, Nurse, can I talk? Okay, what I can Buy Explore, you can send me a message on Instagram. You can send me a message on Instagram. I think I'll be checking my Instagram today and I'll be responding to messages on my Instagram today. So what I would advise you to do is to send me a message on Instagram. Let me know what you want to talk to me about. And if you are just watching this live section, I believe you're enjoying the live session. All you need to do is to double tap the screen to like the video. Double tap the screen, it automatically likes the video. And also subscribe if you are just coming across this channel. Subscribe if you are just coming across this channel and turn on the notification bell. So back to what we are saying, we are talking about abortion. So we had a break in transmission. We are talking about abortion and we would like to know what your take on abortion is. Is it a yes or a no? And why do you feel it's a yes? And why do you feel it's a no? Because my personal belief, like I said, I can't share my personal belief with you on abortion. I am someone that, like, if there is a baby, I'll keep it. If there is a baby, I'm going to keep it. So that's my belief. So, but people carry out this abortion for different reasons. There are some medical conditions that require people to actually abort a baby. For example, if a woman has cancer, and this particular woman needs this chemotherapy treatment as soon as possible. This chemotherapy treatment needs to go on. They might need to abort the baby for the woman to get that cancer treatment. So in such situation, it is advisable. All right. So there are some pregnancy that can actually cause uncontrolled high blood pressure. Like when someone is pregnant, they frequently have high blood pressure. They're having preeclampsia, frequent preeclampsia, that the doctor is like scared that it can lead to eclampsia. And eclampsia comes with convulsion and a lot of things. The doctors might advise, we need to take away this baby. There are some pregnancy that comes that can even worsen heart failure, that can worsen kidney failure, and the doctor will tell you we need to take out the baby. All right? So there are different reasons why a baby will be aborted. And also, when there's a miscarriage, definitely it has to be completed. When the fetus is not viable, there's what we call them, is it what we call them, what's it called? It's a blighted ovum. The fetus is not viable. It cannot form. The uterus absorbs itself back. So in such a situation, the baby needs to be aborted. In situations where the fetus is growing in the fallopian tube, the baby needs to go because the baby cannot survive in the fallopian tube. The baby cannot survive outside the uterus. When a woman is having an ectopic pregnancy, the baby has to be taken out. So there are different reasons why abortion can take place. There are two types of abortion. We have the medical abortion and the surgical abortion. So in terms of the medical abortion, this is a type of abortion that the doctors are going to prescribe some medications for you to take. So they give you these medications. It can start in the clinic and it gets completed at home. But for surgical abortion, you have to go to the hospital and it takes like 5 to 15 minutes to take the baby out. So depending on how long the pregnancy is, that's what is going to determine what the doctor is going to advise on the method of abortion. Okay, so like I earlier said, if you have any question, let me know in the comment section and let me know what your take is on abortion. So we have Solomon. Solomon, how are you doing? Trust you're doing great. Do you have any question for us on the comment section? Let us know in the comment section. And also, Solomon, let us know where you are watching us from. By Explore, let us know where you are watching us from. If you are still here, by Explore, let us know where you are watching us from. Sammy, okay, Sammy, I think I know where Sammy is watching us from. He said it already. Super Toyota, if you are still here, can you let us know where you are watching us from? And if you are watching this video, just double tap the screen twice and it automatically likes the video. I'm waiting for your questions. Do we have any questions so far? Do we have any questions so far? For those that are anticipating our video, all you need to do to get the next video, turn on the notification button so you get notified when please, I hear that abortion can cost both your life and the baby. Vera, good afternoon. How are you doing? Trust you're doing good, Vera. So you say, I hear that abortion can cost both your life. Are you trying to say it can cost both your life and the baby? Vera, you can ask a question, Vera. Vera, feel free to ask your question, Vera. Sammy said, based on some religion beliefs, do you agree that abortion is committing murder? Like I earlier said, personally, in my own religion, as a Christian, it's murder. Like, yes. So that's my own belief. That is my own personal belief about it. Okay? But when it is needed, it is needed. Especially when it is needed to save the life of a baby, or when it's needed to save the life of the mother, then it is needed. So that's it. It's kind of a dicey thing. Vera, feel free to ask your question. So generally, I think that's Gift David's question. Abortion is safe. It's safe if done legally and professionally in a proper healthcare setting. It is safe. if it is done legally and professionally in a proper healthcare setting, it is safe. Okay. So Vera said, please, I was diagnosed with uterus inflammation and I was told to get some drugs. I noticed that anytime I take the drugs, I feel so much pain in my right uterus. What should I do? So personally, like I said, our channel is like for general education. It's not like a personalized advice thing. So what I can give you advice on for that uterus inflammation is to go back to the doctor. Let them know this is what you are passing through whenever you take that medication. Okay, let them know you don't have to stop the medication. It's not advisable for you to stop the medication when the doctor has not told you to stop, because you will only stop the treatment. You will only stop the treatment. So if the doctor has told you to take this particular medication for like 3 months, 4 months, 5 months, I advise you to stick to that medication. I advise you to take that medication. And if you are to stop that medication, go back to that doctor and let them know this is the side effect you are having. Probably the doctor might prescribe another medication for you, or the doctor might give you some painkillers to subside the pain that the side effect is giving you. So one thing about medicine is that before they give you medications, they weigh the benefits, the good and the bad. So if you go back to the doctor, you let the doctor know this is the side effect I'm having, then they're able to say, okay, take this medication and add to it. It will help with the pain. Or stop this medication. I'm going to give you another medication. All right. So that's the best thing to do. Please and please don't stop the medication without the doctor's permission. So what I would advise you to do, if you are less busy today, go and meet the doctor and sort it out. I don't know if that makes sense to you, Vera. Okay, I stopped taking it because of the pain. Vera said, okay, ma. You're welcome, Vera. I'm glad I've been able to answer your question, Vera. So let's keep the questions coming. And if you are just coming across this channel, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, though I'm not practicing in the UK as a registered midwife, but I'm practicing as a registered nurse. So if you have any questions in regards to your health, just drop on the comment section. This is the health education, like it's health education. We are health educating the public. All right, so just drop on the comment section. Sincerely, it gives me joy to answer your question. I'm super excited answering your question. And if you are watching, you've been here so far, just double tap on the screen to like the video. Double tap on the screen to like the video. Sammy said, it is not clear. Is there any need to commit murder? There is no need to commit like a physical murder. All right? There's no need to commit murder. What I'm trying to say is that if the baby in your womb pose a threat to your life, the doctors might require for you to commit abortion. They might encourage you, they might recommend abortion for you. Okay? So that's what I'm trying to say, Sammy. So Vera said, is every discharge related to infection? No, Vera, not every discharge is related to infection. Not every discharge is related to infection. As a woman, you should have discharges. There should be discharges on your pants. Yes, it is normal to have discharges on your pants as a woman. If you're having discharges that does not smell, it is not causing itchy, it's not causing any discomfort, it is not cottage cheese, then it's not something for you to be worried about. As a woman, even during your ovulation, you have this egg white discharge. Egg white discharge that is slippery. That's a sign that you're ovulating. So you having discharge in your vagina as a woman simply means you are healthy. But some discharges might be a sign of infection. So that's why we have different discharges and what they signify. If you're having cottage cheese discharge, that could be a sign of yeast infection that needs to be treated. If you're having yellowish discharge, red discharge, green discharge, those are infections that need to be treated. But having a normal discharge that does not smell, that does not cause discomfort, that does not cause itching, that doesn't require you having temperature, it is normal. Okay, discharge as a woman, discharge is normal. It's just your vagina doing its works. It works. Okay, I don't know if that makes sense, Vera. So Gift said, thank you so much. You're welcome, Gift. I'm glad I've been able to answer your question. If you have any question, let's keep it coming. Let's keep it coming. Don't stop. Let's keep the questions coming. Nurse Miss Mary is here to take your questions today. Let us keep the questions coming. Vera, is your question answered now? Vera, are you still there? Is your question answered now? Vera, I want to know if your question is answered, if you got it, or you're having network hitches. So that's Sibo Mokela said hi. Is this? I don't know if I pronounce your name very well, but thank you for joining. Kindly let us know where you are watching us from. So Gift David said, please, is it possible for a lady to see her period 3 times in a month and it flows very? No, it's not normal. Please and please, if a lady sees her period 3 times a month, she needs to see the doctor. The highest that can happen in a month is 2 times a month for those that have a short cycle. But if a lady is seeing her period 3 times a month, then she needs to see the doctor. I made a short video on that, just that I've not edited this. That's a concern. She needs to see the doctor. If a lady is seeing her period 3 times a month, it is something she needs to see a doctor about. But if a lady is seeing her period twice a month, like it's possible the lady has a short cycle, it's understandable. But 3 times a month, it's not in any way understandable. This particular lady has to see the doctor. Is that okay, Gift David? Is that okay, Gift David? Gift David, does that answer your question? Let's keep the questions coming. Don't be shy. There's one thing about being shy when you're like, oh, should I ask? Should I type? If nobody's going to know. They are not going to know. Nobody's going to know. They are not going to know. So feel free to ask your questions on the comment section. All right? Nobody's going to know. They are not going to know. Nobody's going to know. Just ask a question. Like it's an open section. This zone is like a non-judgmental zone. So we are not to judge, but we are expected to respect your decisions. We are not judging. We are just respecting your decisions. Okay? Sabo said, thanks for your advice. You're welcome. You're welcome. Do you have any question for us? Where are you watching from, Sabo? Where are you watching from? Let us know where you're watching us from. And if you have any question, the comment section is open. We are ready to take your question, okay? Okay, someone is asking, please, what could be the cause of spotting during the first trimester pregnancy? Okay, in terms of spot, if it's just like a tiny blood, it might be as a result of implantation. Like the baby is trying to go into the walls of the uterus. The baby is trying to, for example, this is the uterus now, this is the womb. So the baby is trying to stick to the womb. The baby is trying to stay inside the womb so that it doesn't fall. It's like having this thing inside now. If this thing is inside the womb like this, oh, let me look for something to explain it better. Do I get a bit to explain it now? Let me use this one. This one is smaller. So for example, this is the womb. This is the womb and this is the baby. So what causes that spotting in first trimester? It's possible the baby is trying to stick. For example, the baby is trying to stick to the womb. You know, the baby has to, like, should I use the word dig the hole? Let's use that, like, to break it down. So the baby is trying to stick to the womb. So that can cause spotting in the first trimester. But if the spotting is not spotting, you are bleeding, see the doctor. Okay, but if it's just tiny bit of spots, it might be as a result of the implantation. The baby is trying to stick to the womb. The baby is trying to attach itself to the womb. So that could be the reason for that spotting in first trimester. Is that clear, Sammy? Sammy, is that clear? I need to go through this. Sammy, does that make sense? It said it started as brown spots to light red till the point of thick blood drop. When you say thick blood drop, is it the one that fills up the pad? Does it fills up the pad? Does the thick blood drop fills up the pad? Can you estimate the amount of blood? If it's not much, it's not something of concern. But if it's a lot, you can see the doctor preferably, just to rule out anything. But generally, spotting is sane. But if the spotting becomes a lot, then it's something of concern that the doctor needs to examine and find out what is wrong. Is that okay? Okay, it's normal, but what I would advise you is for you to also report the whole thing that's happening to your doctor. Because I said just a drop occasionally. So it's normal, but it's very important for your doctor or your midwife to know. It's very important for your midwife or your doctor to know about it. Does that help, Sammy? All right, that's fine. That's good. All right. Well, how was this test and scan? Was it okay? And how far are you gone in the pregnancy? How far are you gone with the pregnancy? And what did the doctor say about the results and scan? Because like I said, spotting generally it's normal. All injections and medications prove abortive, but after a while, it stops by itself. Okay, that's fine. Glad it stopped because generally spotting is normal. It comes and it goes automatically because it's just the baby trying to implant. It's like, I don't really know how to describe it, but the baby is trying to implant into the walls of the uterus. It's like invading the walls. It's like you putting a nails in the wall, like trying so that your clothes stays. Is that the best illustration for it? But just know that the baby is trying to implant in the walls of the uterus. So that's what happens. All right, that's fine. You don't need to be worried, okay? You're welcome, Sammy. Congratulations. As you expect your bundle of joy soon. Congratulations. When is abortion tag risky? Abortion is tag risky when it is not done legally and professionally. Okay? When you take abortion pills without the consent of your doctors, that is when it is tag risky. You get? So abortion is generally safe when done in a well proper healthcare setting. But if it is not done in a proper healthcare setting, it is tagged risky and it is tagged unsafe. So that's it. Dodge, does that make sense? So what I'm going to do after I end this live section, I'm going to be shooting a video on how to use a female condom. See, Dodge, I can't give any advice here. What I advise you to do is to always speak with your doctor. There are two medications that are usually given when it comes two different medications that are usually given when it comes to medical abortion. So the doctor is going to tell you when to take it, and they are going to give you the appropriate dose to take. So before they give you appropriate dose to take, they are going to ask you some series of questions. So personally, I can't tell you if it can be taken twice. I can't tell you how many doses you can take. You have to see the doctor for personalized advice. All right. That's where my scope of not say carried me to. So I can't do any prescription. I can't tell you what to take, like how many doses you have to take. I can't tell you what, but it's two different type of medications that are given to actually help with abortion. I'm gonna be making a video on it like soon. Always see the doctor. If the first dose doesn't work, it's advisable for you to see the doctor. Get help from the medical doctors, from your healthcare practitioner, your healthcare provider. Like, we don't have much question. Should we end the live now? So we're going to be ending the live in 3 minutes time. So if you have any question, this is an opportunity for you to ask before the live goes closed. So we have 2 more minutes before the live end. 2 more minutes before our live section ends. So we have, let's say, 1 minute to go. We have 1 minute to the end of the live. If you have any question, feel free to drop on the comment section before we leave. Should we end the live now? So this is me saying thank you for joining our live section for today. I really do appreciate all the comments, questions. Hopefully, we tend to see more often these days as we try to get back on the beat. All right. But if you have any question, don't forget to keep it up for our next live section. To know the time which we come for our live section, all you need to do is to subscribe to our YouTube channel. There is a bell close to the subscribe button. You turn on the notification bell. That sends you a notification whenever we go live. So whenever we go live, you are able to get the notification and you are able to join. So that's one thing I would advise you. If you want to really keep track of our live sections, our videos that are going to be dropping, all you just need to do is to turn on the notification bell and subscribe. All right. So we have new people that just came to join. My name is Mercy Mary. I'm your favorite nurse midwife in Nigeria, but I practice in the UK. So I'm your favorite nurse midwife. So if you have any question, feel free to always express yourself. Feel free to tell us how you feel, what are your pains are, what your concerns are. Just let us know. We'll try to give you health education. But for personalized advice, always consult your doctor. Thank you very much and see you in our next video. Bye.